Hi, good evening, everyone. Hope you're having a good day. This is our case presentation for the molecular imaging. Our case is of a 13-year-old female patient who presented to us with right-sided chest wall swelling with respiratory distress. Now, first things first, the clinician ordered an X-ray. Now look closer. On the first spot, you can see a pacification of the right hemithorax almost completely with mediastinal shift, which explains why the patient was suffering from respiratory distress. But the question is, does the X-ray tell us something more? Look closer. There. That's a very ugly looking rib. There is expansile lytic lesion with cortical destruction counting down. This is our ominous sixth rib, the anterior portion of it. Have a closer look. You will see a soft tissue mass epicentered around the sixth rib with coarse calcification. Now, because as we say, the emergencies are the emergencies, so the patient's respiratory distress was addressed first by having an ultrasound to assess if the patient can have a pigtail inserted. This is the ultrasound image. Now, they're very difficult. They're a little bit more difficult to look at it. So, this is the lung shadow. That's the effusion. And that's our mass, soft tissue mass, inseparable from the chest wall. The patient had a pigtail inserted, and after being vitally stable, a CT was ordered. Now you can see on the picture on the right, you can see the pigtail, and then you can see anteriorly the sixth rib, expansile destructive, with soft tissue component with a coarse calcification. The sagittal reformatted image, you could see the sixth rib with what we can all identify. This is textbook, periosteal reaction, sunburst appearance, textbook. We all know what this can be, or we have it in our mind. This is rib osteosarcoma. Now, because osteosarcomas are not commonly in the ribs, we have to put other considerations. We're talking about rarity here. So the differential is Ewing sarcoma, but with Ewing sarcoma, calcifications in the soft tissue component is not that common. So what else can we think of? Histiocytosis. Again, soft tissue component is not that common. Rhabdomyosarcomas and non-rhabdomyosarcoma soft tissue sarcomas, they're also on the table. So we asked the patient to have the biopsy, and the biopsy confirmed the osteosarcoma. Now the patient began her journey with our molecular imaging because bone scans are very crucial when it comes to primary or secondary bone tumors. So she has a baseline bone scan in February 2023. And there you can see at the right anterior chest wall a globular hot uptake. Posteriorly you can see our ominous sixth rib with linear hot uptake. Now the patient had her baseline and then was referred for treatment and received her chemotherapy session and then returned for follow-up 3 months later in last May. And that was, well, it's bad news. You can all see there is a progressive course of the anatomical and the metabolic activity of the lesion in the right anterior chest wall, as well as the linear uptake of the sixth rib. But what makes this case interesting is another dark spot in the picture, if you can see it. Let's have a zoom. There. 7th, 8th, the 9th rib. The 9th rib show hot tracer uptake, making us wonder, what is this? Is this metastasis from the osteosarcoma? Did the osteosarcoma extend from the 6th rib to the 9th rib? But why the 7th and the 8th ribs are spared? Also, you can see there is an entity, multicenteric or multifocus osteosarcoma. So we needed an answer. A complementary CT was ordered on the very same day, and this is what we saw. That's our lesion. And that is what we saw at the bone scan. There was a pleural plaque with calcifications just in front of the posterior aspect of the 9th rib. This is what we saw, and this is a pleural-based mets. Now, like we said, primary osteosarcoma is the most common tumor, primary bone tumor in adolescent age, in the second decade. In every million people, there are 2 or 3 people who will have osteosarcoma, and every 200 or 300 cases of osteosarcomas, only 1 will have rib osteosarcoma, which makes this a rare entity. Like we know, osteosarcomas are usually around the joint, the knee joint, with the proximal tibia, and the proximal tibia and distal femur. These are the most common places. And it has male predominance. Bone scan is a crucial and very helpful tool that helps to identify skip lesion, metastatic lesion, a baseline to assess for the response for treatment and for further follow-up. Now, what we want to go home with is look closer at a chest X-ray. It may tell you more than what you see superficially. A bone scan is crucial with primary and secondary bone tumors. A complementary CT can go a long way to identify the specific site of the lesion. Thank you. Have a good evening.
شكرا يا سارة.